On a mission to better serve his patients dealing with declining hormone levels, board-certified plastic surgeon and board-certified anti-aging physician Dr. Charles Virden was determined to create a better method of placement for bioidentical testosterone pellets. Patients using the Virden Method have called it life-changing.
Hi, I'm Damon George. I'm 48 years old and I'm a happy TheraPellet patient. I've been a patient for about 3 years and I just have rave reviews about the product, the process, and the change in my life. I was lucky enough to find TheraPellet through my marriage counselor as we were advised that potentially I had low hormones. We went and did the test and we found out that it in fact did, and I immediately began the treatment about 3 years ago and have been completely satisfied to the point I call it life-changing ever since. Minor to major changes in my life since starting to use TheraPellet. I sleep much deeper, wake more rested, and I need less sleep. That has given my metabolism a boost, and it's also lowered my resting heart rate about 20 points from when I started. So I feel healthier all the way around. It has taken care of some joint pain and some pain that I had that kept me from working out and exercising. So I've been able to change my life in the way that I'm excited to work out, been able to change my diet because just little things compounded to make it an easier choice than making it so difficult. I saw a reduction in weight loss, mostly due to the energy that I was feeling. I was nearly 300 pounds when I started 2 to 3 years ago, and over this time I have steadily lost just about 80 pounds now. It's a complete body change as far as feeling strong, feeling successful, feeling a lot of self-confidence, but because of physical ability, I can lift, run, walk. And prior to that, I was very sedentary. I had an office job and didn't do much. I now spend time out running on the river and having fun with my dog and doing things that are important to me. Because I've been a patient for about 3 years, I've been able to experience the 2 different techniques that are available or have been available with Dr. Virden. The first method is more of a standard industry practice, and it can be painful. I did that about 3 or 4 times, and the process created a lot of inflammation and pain for about 3 to 4 days. I recall sitting in a play and could barely sit. So it was one of those things, every time you jumped in the car, you could feel it for 3 or 4 days. It was also much higher up against the skin, and I had a couple of pellets come out, and discomfort was prolonged maybe a week to 2 weeks after. Even though the benefits were there, it was worth doing, but I didn't look forward to it, and was lucky enough that Dr. Virden's new method is completely different. It is using a different trocar where it is soft rather than cutting through the skin and the fat tissue. I am pain-free the same day, and because we've reduced the number of pellets, we've gone from 12 to 4 pellets. I work out the same day. To me, the technique is really the key to the process and why I'm so happy with it. One of the great side effects so far, and it's been such a long time, for 3 years I've kind of forgotten, is that my self-confidence and my emotions and my ability to walk into a room and be able to communicate with people in my work environment has increased almost every level. Relationship-wise, it has been just a gift. So as far as how it makes me feel emotionally, just a more confident and excitable and active person.
The Virden method of placing bioidentical testosterone pellets using the blunt tip trocar has greatly improved pellet therapy for patients like Damon. By using this specialized tool to place the pellet subdermal, the Virden method drastically minimizes the common side effects of traditional pellet placement. The Virden method, the gold standard in pellet therapy, is now here.